We are following developing health news every family needs to hear. A health department spokesperson says there have been 2 flu-related deaths in our area recently.
Both victims were young children. 10 on your side's Deanna LeBlanc is here with details now.
And Deanna, you talked to doctors, so what did they tell you?
Yeah, first, Tom and Nicole, this is obviously very tragic for those 2 families, and we don't want to downplay that, but the health department says this is not cause for panic.
We've all heard it before. Cover your cough, wash your hands, see your doctor if you have flu-like symptoms. But health officials say they still can't stress those words enough.
Virginia, especially in the northern and the eastern regions, are seeing a huge sort of rise in the number of influenza-like illnesses.
One of the problems, this season's most common flu is a strain that doesn't exactly match up with the vaccine.
As you know, we developed the vaccine sometime in February so that it actually can be produced in time to be dispensed in the fall. So what we were predicting then is actually not what we're seeing actually in the community.
Dr. Chang says that doesn't mean the vaccine is ineffective. It can still help lessen the severity of symptoms.
Flu is widespread now. It has been now for the last 2 weeks. It's still increasing in terms of number of people it's affecting.
So far, ER visits in our area for December are outpacing this time last year. The flu has now claimed the lives of 2 children from our region. Health officials couldn't elaborate except to say the children were younger than 5. And historically, Virginia sees between 1 and 6 pediatric deaths each flu season.
Unfortunately, flu can be a very serious disease.
Still, Chang says less than half the population is lined up to get the flu shot, and flu season doesn't peak until February.
We, are still hoping that more folks will get the vaccine because, as you know, it takes a couple weeks for you to develop some antibodies to the flu vaccine so that you can actually fight it off.
And Dr. Chang says if you do get the flu but didn't get the flu shot, it's best to see your doctor within 48 hours of symptoms setting in because you can get medication to help lower your risk of developing serious symptoms. I'm Deanna LeBlanc, 10 on your side.